Good morning or afternoon, wherever you are. My name is Jan Bardot. I'm originally from San Diego, California. I came up with a vertigo and more likely unbalanced problems. I've been to conventional medicine. I started out with my primary. Primary sent me to vestibular therapy, and that worked great, especially since this problem started on New Year's Day on 2017 when I was getting up ready and I was walking toward the restroom and my knees buckled. My knees buckled, I hit my head. I had the flu the previous 4 or 5 days before that. So obviously the potassium and magnesium was trying to get hit to my heart to keep my heart beating, and it just took me down. And when I hit my head right here, twisted the neck, and vestibular therapy, it actually, I was on the floor, crawling on my hands and knees, that I didn't have any balance. It was that bad when it started out. And went to vestibular therapy, which helped a lot, got me off the floor. I could walk, had walking sticks at first, and I literally was walking like Frankenstein. It's just a very erratic type walk. But my vestibular therapist got me out of trouble, and I got so far with her, and she's great. But I hit a crossroads. And what happened is that I had to do research and get further information. During the time I was doing vestibular therapy, I went to ENT. ENT didn't find anything. Ear, nose, and throat, they didn't find anything. They sent me to a neurologist. They couldn't find anything. They kept insisting it was the brain. And when I went to my neurologist, 11/3/2021, I did mention that I thought it was my neck, but apparently it didn't. It got blown over and didn't get looked at. I had many MRIs. I had MRIs of the cervical area and the thoracic area and an MRI of the brain, and nothing in CT scan, and nothing showed nothing of the brain. So I came to this crossroads, and I had to do research, and I found Upper Cervical Care, Dr. Mercedes Cook. I'm here 6 weeks of treatment, and I can now balance myself better. My dizziness is very much decreased. In 6 weeks, I've improved 50%, 50 to 60%. I can now get on the tennis court. That's the proof of the pudding right there, because being an athlete all my life and playing tennis at a high level, that was important to me to get back on the court. She made it happen with some balance. So for example, for my serve, when I'm hitting my serve now, I'm balanced on that front left leg. I'm not teetering, I'm not going back and forth anymore. And when I'm hitting it, I'm just ripping the ball with little effort. That's what Upper Cervical Care has done for me. It's very gentle treatments, very systematic. It's a slow process, but 50 to 60% better in 6 weeks is phenomenal. If anybody out there has neck pain, please look her up. She can help you tremendously. Don't rely, for those people who've been going out this for a long time and they think it's your brain and you have vertigo and you're unbalanced. She works the C1 and 2 tremendously and systematically, and it works. If anybody out there has been suffering from this, as I did for many years, for 5 years actually, this is the place to come to, and you will start to get out of pain and have everybody else on the conventional medicine that's focused on the brain, and they need to look at the neck. They've got to start looking at the neck. But the difference in pictures, conventional medicine uses, you lay down and do the MRI. Here, you do a 3D image and it goes all the way around your head. Okay, so it's 3D and it catches a lot more other than laying down. So with that information, you can do much more for yourself. So anyway, I'm very happy, and I'm back on the court again. I hope to be competing soon, but I feel very good and very happy, and make the switch. Don't forget about your neck. Even if you had a concussion or any kind of hit to the head affects your neck. That's the important thing. Without further ado, I hope everybody has a great afternoon or evening wherever you're listening to this, and kudos to those people that have helped me. Thank you very much.